So thank you for joining us. Today we have Dr. Andrew Heyman and Dr. James Laval presenting a preview of the pre-conference Las Vegas workshop titled Personalized Lifestyle Medicine, Relevance for Nutrients and Lifestyle Therapy. It will take place Wednesday, December 10th, before the World Congress kicks off at the Venetian Palazzo on December 11th. I will pass it off to Dr. Heyman and Dr. Laval to begin the preview.
Great. Thank you, Jordan. The first thing I want to do is be able to thank everybody involved in putting the pre-conference together. Obviously, Metagenics for the sponsorship of putting the pre-conference together, and of course, the team that's going to present, Dr. Heyman, Dr. Pamela Smith, and myself. I think that we're going to provide for you a day that really starts to pull some big drivers together. And I know Dr. Heyman's on the is on this presentation with me, so I'm gonna defer to Andy at certain points during the conversation, because I think it's important that you get a feel for what the target and the purpose of this pre-day conference is all about. And actually, what it's really about is beginning to create targeted and precise recommendations in a complex systems biology world. I think every day I wake up and see a new test that's out that's going to allow us to look at different recommendations for nutrition. And one of the biggest issues becomes is, where do I start, and how can I begin to order the decision process that I make, that I start to move people forward in reinvigorating their health and really getting them to a kind of ground state of a healthy metabolic reserve and having vitality. And so a lot of the pre-conference, this program is introducing the vitality assessment program that we've been working with A4M for quite a while, and that is to really begin to systematize or computerize the ability to have a report that you can follow and give people starting points on what to do. I know we've been talking about this for quite a few years now, but Dr. Heyman and I continue to work on it to the point now, along with Dr. Smith, to where it is, it's in its finished format, and there's reasons behind it. And so, this was kind of the beginning of the thought process of, it's complex. We hear about the fact that diet and drugs and exercise and environmental exposure and genetics and stress and disease are all kind of, filtering down into an individual, creating these interconnections. And although these are somewhat artificial, because it's a whole body metabolism that's actually going on, there are networks that kind of create primary drivers for metabolism. So, for example, the gut-immune-brain connection is one which has been written about a bunch and lectured about a bunch over the last few years. And obviously, I know we've been talking about it for a decade or so, maybe even longer at this point. And then other being, thyroid, adrenal, pancreas, cardiopulmonary, neurovascular. But the net of this is that there's relationships that have negative feedback loops and act as drivers to why a person ends up feeling the way they do. And if we can identify the primary drivers in the dysfunction, we can move people towards changes in their health that are positive and consistent. And, once again, it gets complicated, right? I think, Andy, I think you can ascribe to this, that people are getting, they're just getting these programs that become unreasonable or difficult for a lot of patients. It's too many pills, too many times a day, all of that leading to a non-compliant patient. So you tell somebody to take something even 3 times a day, and then when they call up and say, hey, I'm getting a little bit of a loose stool, and you say, well, drop the middle dose out, the first thing they tell you is, well, I'm already not doing the middle dose. What do I do now? And so the purpose is to create a real organized network, and realizing that things are in rhythms in the body. And I know, we've had a lot of discussions around this, that, hormones are pulsed through the body, and that there's rhythms that need to be kept, and you have to account for that. And one of the best ways to account for that is to begin to look at these networks and start to normalize their function. And begin, for example, cortisol and melatonin. Melatonin resets the cortisone day cycle and gets the periodicity back to cortisol. When melatonin's out, that creates a problem with cortisol regulation and creating the flattening of the cortisol curve. And this is kind of a a perfect example. And I'm gonna hand off to Andy in just a second here to get his comments on this. But I found this in the Endocrinology and Metabolism Clinics North America, and I could have remade this slide, but I thought it was important that I just take this, lifted it right off the paper, because this is what I'm talking about when we talk about complex networks. When you look at free cortisol in the middle, I know Andy's done a tremendous amount of pioneering work on the effect of cortisol, but you see that these elevations in free cortisol lead to changes to the left, growth hormone, IGF-1, growth hormone releasing hormone, to the right, gonadotropin-releasing hormone, luteinizing hormone, estrogen, testosterone. Above, alterations in immune function. I'm not sure. I think we would probably argue that it's not a decrease in immune function. We would say that there's probably an alteration in immune function, but there is a definite decrease in neurogenesis due to it. So, the neurons get blunted and they don't rebud. And then you drop to the bottom half and you see cortisol having these effects across blood sugar, blood pressure, and visceral fat. So when you look at this, you see that the flux on cortisol literally reaches to the relationships of thyroid, adrenal, and pancreas, right? Insulin action, more visceral fat, cardiopulmonary, blood pressure is up, and then, of course, gut immune brain, because shifts in the immune system and the effects on brain chemistry leading to this outcome. But the reality on this is that, and the outcomes are listed, osteopenia, sarcopenia, and as you can read on here. So, but the outcome of this whole process really is that people have varying aspects of this going on within them. It isn't linear. And so we need to begin to characterize that even though they're nonlinear relationships, where these shifts are appearing now and where they're likely to appear in the future. And Andy, I think I'd love for you to comment at this point on kind of that previous slide, and then of course this network effect that we're going to teach about in the pre-conference symposium.
Sure. I mean, I think that specifically as it relates to cortisol, there's so much emerging evidence on the role of cortisol in all sorts of disease processes, and I think finally medicine is beginning to embrace the idea of a stress response and an abnormal stress response in the context of all sorts of illnesses, and in ways that we never really understood before, and that you can have semi-permanent or permanent alterations in the stress response that have real meaningful impact on sort of the evolution of biological illnesses. And with that being said, medicine is trying to come to grips with these kinds of interrelationships. In fact, I was at a men's health meeting yesterday, and one of the world's experts on testosterone was there. He's done some major reviews on testosterone, published over 160 studies. And he had some interesting comments, especially related to the recent research on testosterone and heart disease. Number one, the research on testosterone up until recently had been very positive in that regard. But there was a study that came out in JAMA that turned everything on its head and that there's risk. Well, when he and his research group went back to the original research, he showed that the data had been wrongly analyzed. But even more importantly, his thought was that when you look at critical relationships, and I couldn't believe he said this, this is a very conventional physician. He's an endocrinologist who said, when you look at the relationship of testosterone to other hormones, we've often gotten it wrong, that we're so overly focused on testosterone as a target of intervention, not realizing that, in fact, alterations in the stress response in particular and brain-related changes that go along with it affect testosterone levels. And I nearly fell out of my chair because it was the first time I'd seen a very conventionally oriented physician really trying to begin to make the same links that we've known for a long time. And the challenge with this is that we live in a world of information. And in many ways, I think the future physician is going to have to be an information manager. And that means we'll have the ability to collect more and more data on patients. But what's important is, what does that data mean? And how do the points connect or not? It's going to require some modeling in that regard. The Triad system allows us to separate out the noise of that information from what's meaningful. And we break down these physiologic relationships along very important nodes or axes because we know there are important influences that are often bidirectional between hormones and the immune system, between the nervous system and the hormones, and so on and so forth. The triads characterize all that, and it allows us to be efficient information managers in that regard. It's an elegant system. It reflects the most current thinking in systems biology, but it's also very, very clinically relevant.
Yeah, and I think the other piece to it is what we hope that people come away with at the end of the day is a better way to communicate with their patients about what's going on with their chemistry, that it somewhat becomes a new language of health and wellness for them to work with their patients, because people don't understand when you say MTHFR and COMT and ApoE3 or myeloperoxidase. The consumer's sitting there lost, but consumers understand you're losing energy. Your brain is more foggy. This triad relates with mental clarity. You know, this triad relates with why you're bloated. And here's the reasons why. The whole purpose of this was that to help create a more of a systematic approach, because we have so many fellows that have gone through training. And yet, consistently, what we hear when we talk to fellows is they just want something that can help them to get started and help themselves get oriented to somewhat of a true north that makes it easy. And so this next slide, and I don't want to go into this in depth, but this is the slide that Andy and I probably have a tattoo of it on us. So we use it so much because I think it's one of the most important, simple slides that tell us that the HPA axis and the gut are intimately tied in along with cortisol. And, as your HPA axis gets under stress and your sympathetic output goes up and your enteric nervous system fires, the corticotropin-releasing hormone starts to create permeability changes in the gut. At the same time, you're getting more mast cell release, which is triggering inflammation and immune activation, which, of course, leads to these kind of increases in antigen presentation. But the point of this is if there's an organizing nature to this that says when the cortisol goes up due to chronic stress, there's this reaching or stacking into other systems that starts to occur. And you can begin to look at where those networks are interrelating at by looking at the data. And this is, one example, the whole aspect of adrenal, thyroid, and pancreas response. But in the pre-conference event, what we're going to talk about is looking at, and this is just an example of the kind of reports that we run, is looking at, well, what are the relevant adrenal labs? What are the relevant pancreas labs? What are the relevant thyroid labs? And then where do they rank in terms of where someone is trending to be in or out of balance? And I think, to Andy's point, it's information management for people. We don't want to wait until people were out of bounds to correct them back into wellness. The earlier we can catch the myriad of trends that shift, the better off we are. And so this is the whole purpose of this day-long discussion, is to really orient towards what are these interconnected networks, and how do we start to recognize when one shifts into a disturbance with another, how they begin to relate to each other, and where you begin to look at critical shift points and break points in someone's metabolism that maybe needs to be prioritized. And so it organizes in things like the gut immune brain. If you notice the gut, we measure things like diamine oxidase, LPS, zonulin, secretory IgA. Obviously, things are being measured that could have impact in the gut, for example, monocytes or eosinophils, and literally points or relevance occurs from those lab readings, even though they're oriented in the immune area. They still feed into the gut. But the lab values are basically formatted so that each system gets its due. When you look at cardiopulmonary, and neurovascular as well, same thing. this is just a good example of, how cortisol, I think, Andy, I think you sent this to me, or that's one or another, we're zipping this thing back and forth. But this whole thing of hair cortisol being predictive of future heart disease risk, just something as simple as looking at cortisol could have a dramatic impact on your cardiopulmonary neurovascular network. And Andy, maybe a few comments on that. I know you've talked a lot about the whole aspect of cortisol and its a direct effect on cardiovascular disease.
Right. Well, what we're learning is that cortisol is both directly and indirectly injurious to the lining of the blood vessels, and it accelerates heart disease. It creates localized and systemic inflammation, as well as cardiac electrical irritability. And in some ways, it's not surprising that this data is coming out suggesting that, in fact, it may be one of the most, if not the most potent risk factor for having an MI. And there's a lot of good reasons for that because of the universal ways in which cortisol affects not just the vascular tree itself, but the nerves that live around it, as well as the vagus nerve and the sympathetic drive, and even more centrally in the brain. All of these alterations are occurring, and it's a unfortunate and potent mix with regard to the risk for heart disease.
Yeah, exactly. And so so once again, it's organizing and looking at the clinical pearls of what do you look at for that. Simple things like, what about pulse? Yes, heart rate variability, the effect of blood pressure. What are the values across all of these networks that might show the heightened risk is related to cardiopulmonary, neurovascular effects, and that's where the primary damage is at, or is it adrenal, thyroid, and pancreas? Where's the primary shift at? And I know we kind of talk about this a lot, about the whole effect of going across two triads, meaning that as your cortisol goes up, your DHEA goes down, you lose your testosterone production because of alterations in luteinizing hormone that occur. And then you have the increases in insulin resistance that occur, which causes visceral fat gain, obviously sympathetic nervous system dominance, which then drives more cortisol and more inflammatory compounds. So we're going to go through a lot of these relationships, but then go through what are some strategies that you do to break these relationships when they become dysfunctional. And so it's this deeper understanding of these triads that are incredibly important, which are, thyroid, adrenal, pancreas, gut, immune, brain, cardiopulmonary, neurovascular, liver, lymph, kidneys, so organs of detoxification. But once again, what we've found over the last 15, 20 years is that a lot of people think of organs of detoxification like, oh, it's my liver and my gut, but they forget about the kidneys, and we're seeing more and more people in kind of pre-CKD events or early CKD events, and a lot of this is due to environmental toxicity or the fact that you're pushing a system that is antioxidant depleted to attempt to detoxify. And the liver and the gut may be detoxifying fine, but the kidneys are at risk. And of course, the fifth triad being testosterone, estrogen, and progesterone, and how it interacts with the other entities. And then what we really get across, and this is kind of how we do it in our reports, is that there's a value we place on what symptoms people have, what lab scores they have, and it starts to kind of bear out when you look at the symptoms they're having and the labs they're having. There starts to become a really good correlation between the outcomes research and the lab data, because all of you, I think, Andy, wouldn't you agree, you get a lot of people come in that they got a ton of symptoms, but they may not have really bad labs yet?
Yeah.
And sometimes you have people with really bad labs and they don't have a ton of symptoms yet. So it's kind of getting them to cross-correlate. And what I know you're doing a lot of work looking at new research, and I think outcomes research is getting a lot of eyeballs at it nowadays.
Yeah, absolutely. More than ever, our ability to collect data is growing, and we'll be able to use that opportunity to understand and strengthen the links that we see, and even find new links and relationships within the data that we're collecting.
Yeah, and so for example, in the report that we have here, we show what are all the labs that are out of balance, what created the score, and therefore in this particular individual, for example, where are the biggest disruptors of that person's metabolism at? And I know for the fellows that have gone through Triad training, they use this all the time in a manual format that we've been teaching, and it's helped them to really reshape the way they face and discuss the cases with their patients. And so this day-long primer or pre-conference event really does serve as a primer to understanding the triads. And Andy, you may want to comment on, I know we just went to Australia and did a day-long pre-conference primer on the triads. What were some of the comments that you were getting back from the docs? I know I had gotten some, but I mean, I just kind of want to, get the feedback, and we haven't had a chance to really discuss it since we've been back, but I think we had a lot of happy people.
Yeah, absolutely. And one of the things that always strikes me when we do this teaching is that one of the more common comments is, now that you've shown me these interconnections, I knew they were there. And it's almost as if I just couldn't connect the dots myself. But I had this sense that after seeing, however many thousands of patients physicians see, that we know it's there. We know it's there clinically. And what the triads do is begin to reveal that in a very discreet way. And so in some ways, the triads allows practitioners to come to know what their instinct has been, that these underlying relationships are there, that the body has an internal organization that's repeatable and reliable, and it just takes a little bit of effort to connect the dots to show what that internal structure is.
Yeah, that's well put. That's exactly it. I think I'd have to concur with you that most people just go, you know what, you guys are really putting a lot of the connections together, that it was almost like a veil between understanding what was going on in the patient and being able to really figure out what they needed to do. So this was, so it's great. I agree with you. And here's a great other way to think of it. And Andy, I'm going to let you do this one, because I think this is what's important for us is for you to understand that the effect of cortisol reaches across several body systems. And so when you look at what obviously we don't have maybe an MRI on here, but in terms of just looking at a traditional lab, when you see shifts away from these ideals and cortisol is off, well, now there's a more global impact. And so you may want to comment on these, Dr. Heyman.
Sure. So, with cortisol-related abnormalities, and this can be either too high or too low, or if the pattern is not diurnal, if we have flattening of the curve, as we call it, there are some relatively reliable changes that typically occur over time. Blood pressure does tend to elevate. We talked a little bit about the injury to blood vessels. We also see changes in pH. The body actually becomes more acidic. And this is a compensatory response to alterations in glucose control. But this can have serious and even dire consequences as we become more and more acidic, and we see enzyme systems begin to unravel, essentially. The body loses its ability to detoxify, and in fact, it's a predisposing state to cancer. So this is a real serious one that often gets overlooked, but we actually feel is pretty important. You see changes in sodium, mostly through the renal tubules and the way that the body handles sodium balance. There's also quite a bit of magnesium wasting that occurs through the kidneys as the person is under stress. We also see changes in potassium. This mostly has to do, again, with glucose control or loss of regulation in that regard, especially because of the direct relationship between cortisol and insulin. There's a fair bit of data now on potassium and its relationship to stress-related abnormalities and sugar-related abnormalities. There's some discussion about what is the correct serum cortisol. We've provided a range, but there's clearly too high and too low. The saliva 4-point cortisol is also important, probably more important than a single sample. We've talked about this in the past in great detail and how important it is for the diurnal pattern to be present high in the morning and lower at the end of the day. SIGA, which represents immune activation in the gut and reactivity, which, as Dr. Laval mentioned, occurs through multiple mechanisms related to stress, as he pointed out in one of the prior slides. DHEA, which is also sort of a sister hormone to cortisol in a sense, it's neuroprotective against cortisol's damage to the brain. It's considered a hormone of well-being, and it stands in direct relationship to cortisol and acts often as an antagonist. IGF-1, growth hormone, which is also very responsive to changes in cortisol. Cortisol is a catabolic hormone. It dissolves the body, literally. That's one way to think about it. Growth hormone is an anabolic hormone. They also stand in antagonism to each other. When an individual is under stress, we often see lower and lower levels of growth hormone in the same way that we see lower and lower levels of testosterone. There's a direct antagonistic relationship between insulin and cortisol. As cortisol levels go up, it antagonizes insulin and leads to insulin resistance. So it's a double whammy when patients are under stress and are reaching for carbohydrates. It can cause many, many different metabolic changes that are not healthy. And then resting pulse. Resting pulse changes when a person is under stress. They can be persistently in sympathetic overdrive, and we see resting heart rates begin to climb. The critical point, we think, is around 76 or so, that when the resting heart rate rises above that, we have a pretty strong indication of cardiovascular risk in particular.
Yeah, and so this is just when you look at all these parameters, what we try to teach in our class is the fact that just like these are multiple points of relevance for how disturbed your cortisol is, there's multiple points of relevance for your cardiometabolic index, for your immune index, for detoxification, for inflammation. And so it's taking a more global effect or thread and moving through all of the metabolic networks and finding out what's really the global impact on your metabolism that's creating your, what I would call your wellness risk assessment. And of course, I always have to take into account things, medications people are on, what nutrients are being depleted, and how those nutrient depletions may be affecting your metabolism. And that's something that we discuss as well. But as you know, as Dr. Heyman just went through on the global impact of cortisol, it's not just about what your cortisol and DHEA is doing. It's about how advanced, whether it's thyroid antibodies, whether it's immune alterations, and then creating a global assessment tool against that. And, this is just kind of, we like to be able to explain them. So we, give you guys information that allows you to be able to, explain what these mean to the consumer so that they can read it and go back to their spouse. And after they've paid, typically in a cash practice, a decent sum of money, they go to their spouse, and the spouse asks them, what did the doctor say? And typically the person can't remember 90% of it, and most of the terms are things that they never were educated on to begin with. So it's giving you tools that help you to be able to create improved compliance, improved adherence, and then allow for the education process for that patient to take place. And this is just examples. And of course, these are more of the education pieces that we make available, which you can look at. And I think, Andy, wouldn't you say that that's probably one of the biggest things you get is that somebody comes back and asks you, now, what's estrogen again? What does it do? What is CRP? I didn't know what that, I can't remember what that is. Could you tell my husband? Could you tell my wife? It's trying to help get through those types of, complications for communication and practice. And the last piece to this is just kind of our day there in the pre-conference event will include, I think most of you know that for a long time, I've been very involved in getting the latest and greatest, most novel and interesting new ingredients that are science-based, get the information to the fellows so that they're able to include these and incorporate them into practice so that we're able to get shifts and more significant shifts in people's chemistries, get them feeling better quicker. And so, this is just kind of an example of one. I think Evodia, one of the more, interesting ones that I know we'll talk about. There's a new probiotic we're going to talk about that's coming out that downregulates zonulin and repairs the tight junction. So if any of you are, familiar with Dr. Fasano's work, this is a very interesting innovation. So we're going to be talking about several ingredient innovations at this event as well. And, why do I like Evodia? Because it helps to repair tryptophan hydroxylase, helps with dopamine pools, helps with serotonin pools, helps with uncoupling protein 1, which means it's going to help you to burn things more quickly. So you burn fat, you access visceral fat, and also helps with appetite. So this is one of those agents that, when you have people that, and a lot of people are overweight, a lot of people can't control their appetite, I think this is one of those interesting new agents that are out there. And, of course, discussion of Eurycoma, which is, to Dr. Heyman's point on cortisol and testosterone. I don't know how much Andy, have you been seeing with giving people Eurycoma when they've had elevated cortisol? You've been seeing some big bumps and they're getting their tests back. I mean, to your point, that's what your researcher said, right? It's not just about the test. It's about the test and the cortisol, and maybe the test and the cortisol and the insulin. But I know for myself, I've seen 100 to 200 point changes in testosterone just by giving Eurycoma in people that are under stress and their testosterone is, compromised.
Yeah. Yep, that's right.
Yeah, and there's some other benefits, right? So there's aromatase inhibition, some phosphodiesterase inhibition, which I think is excellent, especially when you combine this with bergamot extract. Now you've got something that actually, for erectile dysfunction, pretty powerful when, of course, giving it a little bit of time, not after the first dose, but, very interesting. And, just, study, obviously we always go through the clinical evidence and why we believe this is an up-and-coming botanical that's out there. This has been out for a while, but finally the studies are coming out, in human trials that are more supportive of it. These a couple of the studies, so we don't need to go through the studies now. I know we're running close on time, but I think that, what we really, are excited about is this opportunity to create this event and really start to bring to life these complex systems. And Andy, do you have any closing comments?
Yeah, I mean, I think this is really kind of a life's work for Dr. Laval and I. And however simplified these triads might seem, they really reflect a huge amount of biological data, a review of the evidence, as well as a real strong emphasis on how they orient themselves to caring for real people in the real world. And it's not enough to know the evidence. I think everybody that we work with and that we teach want to become excellent clinicians. And we feel that the Triad system in particular is a bridge to get there. It's a bridge that really has never existed before, and one that we know is reliable and effective and robust over time. So I think we're very excited about what this is, what it represents, and what it's going to mean for anybody who goes through the training program and probably for medicine in general.
That's great. So thank you all for listening. I'm sure we're going to be doing more webinars kind of leading up to the December pre-conference talk, and we look forward to seeing you in Las Vegas at the pre-conference event.
Absolutely. Thank you both so much for taking the time to do this great preview of this workshop. I just want to mention I highly encourage all practitioners to register for this workshop as soon as possible. The A4M is very excited about it, and we're very confident that it will sell out. So I definitely recommend anyone to register for this. It's going to be a great jam-packed, full of education, full-day workshop, also including Dr. Pamela Smith. So we're very excited, and I just want to thank you both very much for taking the time to do this for us. And anyone who wants to register can go online to a4m.com or call 888-997-0112 to register.